It is now time to ask the expert. So joining me today is dermatologist Dr. Elika Hoss of Mayo Clinic. Thank you so much for being here. And she's here to talk about rosacea and the symptoms that we should be aware of and really how to treat it. So first off, what is rosacea?
So rosacea is a chronic skin condition characterized by redness and flushing of the central face. Patients often have small pimples or visible blood vessels, and in rare cases, they can even have facial swelling or enlargement or thickening of the skin on the nose.
Okay, I imagine that can be kind of painful at times if it gets too out of control. How can the diet impact rosacea? Because I know what we put into our bodies kind of surfaces at some point on the skin.
Yes, that's a great question. And rosacea is one of the skin conditions where lifestyle factors make a big difference. So anything that dilates blood vessels like heat, sun, that's going to worsen rosacea. So when it comes to diet, the common foods we think about would be hot beverages, alcohol, or spicy foods. Those are the ones we always want to try to avoid. But there's other ones that we think about too. So there's actually ones that contain a substance called cinnamaldehyde.
Okay, yes. What is cinnamaldehyde?
So cinnamaldehyde is a substance that is found in tomatoes, chocolate, citrus fruits, and cinnamon. And this actually impacts the communication between the nerves and the blood vessels, leading to dilation or visibility of blood vessels.
Okay, so when we're talking about what you eat and drink, are there anything that can improve it in terms of diet?
This is a growing area of research. So it seems like eating a high fiber, anti-inflammatory diet could help. Foods with prebiotics, so this would be leeks, asparagus, apples, bananas.
Oh, the stuff on everything's daily intake, right? Leeks, but yes,
right.
So more of the healthier.
Exactly.
Okay, and then let's talk a little bit about treatments available for rosacea. If somebody is just tired of looking at it, dealing with it, how can they treat it?
So a gentle skincare regimen and prioritizing sunscreen use is the first step.
Okay.
After that, looking for ingredients like niacinamide, azelaic acid, vitamin C. These can all help improve rosacea, and they're all over the counter. There's even something called sulfur soap that you can buy low cost on Amazon that's anti-inflammatory and antimicrobial, which can really help calm the symptoms of rosacea.
Okay, and we know in worst cases you can go and then get medical treatment. Obviously, there's the over-the-counter options for creams and such, but what sort of laser therapy is involved if you want to really try to get rid of it?
Generally speaking, there's two devices that we use for rosacea, and they're mainly targeting the background redness and the visible blood vessels. My favorite one is called pulse dye laser, or the brand name is V-beam.
Okay.
And that helps target the hemoglobin in the blood vessels, makes them swollen and inflamed, and then they shrink down and they look better.
How about that? Now, typically when you go to get laser, you need a couple of different treatments for it to actually take effect. So in that instance, would you need multiple treatments over time just to kind of make sure?
Generally, most patients do well with 3 treatments about 1 month apart.
Okay.
That can give about 50 to maybe 75% improvement in the symptoms. But they're always going to want to come back because rosacea is genetic, and with all the triggers, it's going to want to come back. So maintenance treatments are super important.
Okay, Mom, do you hear that's genetic? Uh-oh, something to look forward to. Okay, Dr. Elika Hoss is going to be here with us for the full hour. So if you have any questions that you'd like to ask her, she's going to be here. Just shoot us a text, 602-444-1212, so we can get you the expert answers that you need live right here on the air in about 20 minutes.